I'm often asked by patients and their parents, how can you accurately measure for myopia control? Especially for patients in our overnight sight program, since they're wearing their molds every night and are typically seeing very well at their follow-up appointments. The answer is that we use several methods to measure for progression in our myopia control patients. For all of our myopia control patients, we measure their vision at each visit. This helps us to make sure that the level of correction is still accurate, and it gives us some information about the level of myopia control. For patients using overnight sight, we also monitor the pattern of corneal reshaping using corneal topography. The topographer accurately measures the corneal curvature changes that we're inducing. We know that when we can achieve an optimal pattern on corneal topography, we're much more likely to achieve good stability of the patient's level of myopia. Another way we monitor for progression for patients in our overnight sight program is to measure their over-refraction once a year. Over-refraction is the process of measuring their prescription while they're still wearing the molds. This helps us to make sure that the amount of myopia we're targeting is still appropriate. And if a patient is becoming more nearsighted, this measurement will also move in a nearsighted direction compared to our baseline. The most important way we measure progression in all of our myopia control patients is by tracking the patient's axial length. The axial length is the length of the eye from front to back. We measure this using a sophisticated piece of equipment called the IOL master. The IOL master can accurately measure axial length to the 100th of a millimeter. As the child grows, the axial length increases. However, when a child is becoming more nearsighted, this increases faster than it should be. Measuring axial length gives us a powerful way to track for myopia progression. We cannot promise that your child will never have an increase in their level of myopia. Even when we do everything right, some children will still have some level of myopia progression. But we can slow down that progression significantly. And by using these methods, we can carefully detect progression and modify our treatment in order to limit the progression as much as possible.